Hello all, this is Vandana. Today we will be talking about the periodontal ligament fibers, also known as the PDL fibers. Let's move on to introduction. So what does this word periodontium mean? It arises from the Greek words peri meaning around and odont meaning tooth. So according to Carranza and Bernard, the periodontal ligament is a connective tissue that surrounds the root and connects it to the bone. It is continuous with the connective tissue of the gingiva and communicates with the narrow spaces through vascular channels. So the space occupied by the pedal is called as the periodontal space, and it consists of a number of cells and extracellular substance, that is fibers and ground substance. We are mainly going to focus on the fibers. So the fibers of PDL are made of collagen and oxytocin. The collagen fibers are gathered in bundles having a clear orientation relative to the periodontal space, as seen in the image. So what are the principal fibers of the periodontal ligament? These are of 5 groups. So let's look at each one of them. Let's talk about the alveolar crest group. For reference, please do look at the image. They radiate from the crest of the alveolar process and attach themselves to the cervical part of the cementum. These fibers resist tilting, intrusive, extrusive and rotational forces, most often confused with dentoperiosteal fibers. Oblique group. Most numerous and occupy nearly 2/3 of the ligament. They are attached to the cementum apically from their attachment to the bone, thereby resulting in their oblique orientation within the periodontal space. These fibers constitute the main attachment. These fibers resist vertical and intrusive forces. Next, horizontal group. They run at right angles to long axis of the tooth from the cementum to the bone. They are roughly parallel to the occlusive plane of the arch and are found immediately apical to the alveolar crest fiber group. They are limited mostly to the coronal 1/4 of the periodontal ligament space, and they resist horizontal and tipping forces. Next, the apical group. They radiate from the cementum at the root to become anchored into the fundus of the bony socket. The apical fibers resist the forces of luxation. They may prevent the tooth tipping and protect delicate blood and lymph vessels and nerves traversing the pedal space at the root apex. These fibers are not seen on incompletely formed roots. Next, the interradicular group. From the crest of the interradicular septum, bundles extend to furcation of multi-rooted teeth. These fibers resist tooth tipping, talking, and luxation. They are lost if age-related gingival recession proceeds to the extent that the furcation area is exposed. Total loss of these fibers occurs in chronic inflammatory periodontal disease. So these are the 5 main groups. We also have something called transseptal fibers that extend interproximally over the alveolar bony crest and are embedded in the cementum of the adjacent teeth. Please look at the image for reference. These fibers may be considered as belonging to the gingiva because they do not have an osseous attachment, so they are not generally considered among the principal fibers. So what are Sharpie's fibers? The bundle of collagen fibers which connect periosteum to the bone. These are Sharpie's fibers. They originate in the periosteum and penetrate deeply into the bone matrix, anchoring the periosteum to the underlying bone. The other fibers found include the elastic fibers, includes the elastin fibers, oxytocin fibers, reticular fibers, and etc. Thank you.